sometimes we find ourselves saying, why me, God? You know, there's recently a popular book written, Why Do Bad Things Happen to Good People? And you might be saying, why do I have to struggle with this asthmatic condition? Or why am I one of those 31 million? Or why do things happen we don't understand? You recently had something happen you didn't quite understand. Somebody stole your mobile home, didn't they?
A motorhome.
Motorhome.
Yes. I had a 24-foot motorhome last week in Dallas, Texas, and someone stole it right in front of me.
I guess one of the hardest things was when people came up to you after that saying, well, you must have done something wrong. That's why why did that happen to you? Yeah. This has been kind of a learning experience, though, hasn't it?
It has for me, yes, very definitely. It was frustrating, and my losses were great. Some of them were covered by insurance, but some of them weren't. And many people asked me where my guardian angels were during that time.
And as you searched and struggled over these particular things, why did that bad thing happen? What kind of conclusions do you draw?
Well, I believe I came to this conclusion, Larry, that if we have a hold on material things to the extent that we can't release them, then it's bad for us. And really, nothing was taken from me that couldn't be replaced. And the real precious things we have are in our hearts anyway, the things that can't be taken away.
Amen. Well, you might be experiencing some difficult things right now that you really can't understand. You might be saying, why me, God? Well, I want you to feel free to call in. You can talk to Denver here or any of the phone operators that we might have. And again, toll free in the state of Missouri, 1-800-334-3276. That's toll free in the state of Missouri. Or in Illinois, 1-800-242-3276. And we often encourage you to call in if you have a particular need so that we can try to help you. In this particular time, if you'd like to help Denver here, you also can feel free to call in because, gosh, you came to me the other day. You said they'd stole everything but one suit that you had, and
that's right. And all of my shoes and everything, and even my Bible.
So these things, good things, bad things can happen to good people, can't they?
They sure can. Yeah.
And so sometimes we feel condemned when things happen like that. We shouldn't, but we should reach out and help one another. If you'd like to offer a helping hand to Denver right now, you can call in and offer him a helping hand. If you have a need to have a particular need, you feel free to call. If you have a need for prayer, feel free to call, because we're here to help you. And the phone numbers are shown right there on your screen, so you feel free to call right now, and you'd be happy to talk to someone.
I sure would. Pray with them.
All right. So feel free to call right now at this time, and I'm going to go back over and ask the doctor some of the questions that you all called in about. And we've had a lot of calls here. Doctors, a person's family has a background of allergy. What are the chances of a newborn babe contacting allergy? Is it hereditary?
Hereditary factors do play a major role in the development of allergy. An often quoted statistic is that if either parent is allergic, then the child has approximately 50% chance of developing allergy. If both parents are allergic, that may go up to 75 or 80% chance. So a strong positive family history is a flag or a harbinger that the child may in fact develop allergic problems. We oftentimes will make suggestions to parents regarding some things that they can do to help delay or prevent the development of allergies in their children. Recommendations like prolonged breastfeeding and the mother altering her own diet while she's breastfeeding, and appropriate environmental controls when they bring the baby home from the hospital. Don't put a newborn infant in an old borrowed crib mattress that's been sitting in somebody's damp basement for 2 years.
Okay, so all those things have to do with it.
Right.
And we want you to feel free right now. We're going to be taking those phone numbers off the screen in a moment, so you're going to want to jot down the numbers. And again, I'll just mention them quick. If you didn't get them real quick, 1-800-334-3276. If you have a question anywhere in the state of Missouri, Illinois, 1-800-242-3276. So if you have a question you want to ask the doctors, call in now. And they're going to be taking the numbers off the screen so that you can have an opportunity, well, to call right now. But we're quickly running out of time. We've got lots of questions here. And just tell me, doctor, if something, you know, there are a lot of things. Earlier we got a question about looking at the sun and sneezing, and some of you all said that that happens to you.
Right.
And we were talking about that a little bit. And here's another one. Does this relate or doesn't it relate to allergic condition? But what can cause the ball of the foot to swell? Swelling in the hand after carrying an object. The doctor has said that it's not gout.
This question has a lot of interesting possibilities because there are a form of hives which can be due to pressure. Now this is very rare, and it probably would not be the first thing that a physician would think of if you came with that kind of a complaint. But there is a kind of a condition whereby pressure or vibration may cause a kind of swelling in the tissues. We call this urticaria. Most patients call this hives or wheals. And there are certain physical causes for this kind of a reaction, namely pressure, vibratory sensations, a scratching of the skin. So it is a possibility that this could be a form of allergy, although we don't think of it as strictly within the specifics of what we're talking about.
Doctor, we've had another question called in. Prednisone is given for severe allergic conditions. If there's a problem, is there a problem with getting this too often?
What was the name of the medication? Prednisone, yes. It's not a good idea to take more prednisone than is necessary. And for this reason, a number of the new medications have come out over the last 10 to 15 years to try and give opportunities for people to get good treatment without resorting to prednisone. For example, prednisone is a steroid medication. We can now give steroids directly into the nose or by inhaler into the lungs, and that's far preferable than giving prednisone or in the mouth, which affect the whole of the body. Now, in severe cases of asthma, for example, or in severe types of urticaria, then prednisone is the only thing to which the patient will respond. But we don't give prednisone unless all the other forms of medication, in particular the newer types of medication, have been tried.
Someone, a 66-year-old lady by the name of Margaret, she had a fire in February in her home. She inhaled a lot of smoke. Since that time, she's had a dry cough. Could this be from the fire or allergic condition or what? Okay.
Well, I would think that it's unlikely that it would be an allergenic condition. Smoke certainly can be an irritant to the lung. And in any individual who already excuse me, suffers from asthma or emphysema, being exposed to smoke, whether it be from a fire or cigarette smoke from the person sitting next to them, can be an irritant and can stimulate a response like a cough or an asthmatic wheezing and shortness of breath. In this individual, it's difficult to say as to whether or not the cough that she's having today is still a result of the fire, but there is a possibility that the fire or the inhalation of the smoke could have had an irritative or even a damaging effect to the lung. In any situation where a cough persists for any length of time, I think it's always a good idea to have that evaluated by a physician, examined, and a chest x-ray certainly if that would be indicated. So I would certainly direct her to her family physician for an evaluation.
Here's another viewer's called in with a question. Says, as a child, he's had extreme allergics and had to have adrenaline shots.
Adrenaline shots.
Adrenaline shots. Okay, I'm kind of going by the spelling. I'm getting my sheets here. Where does the excess adrenaline go in the body?
Okay. That's a very good question as well. The caller is referring to the fact that we all produce adrenaline ourselves, and certainly in situations of stress we know that our hearts will start beating faster, and there are other things that happen because of the excess adrenaline that we're producing. However, certain allergic conditions that your own excess adrenaline is not enough to handle will require the use of outside adrenaline. And most frequently this is used in treating severe asthma or sometimes severe hives or urticarial reactions. Your body metabolizes or uses adrenaline over a period of time so that eventually it leaves your system. But while you are receiving it, you will experience hopefully the benefit of the adrenaline, but also the side effects in terms of rapid heartbeat and other undesirable things, nausea and sometimes vomiting.
And you know, you the viewers have really made this a tremendous show. We are quickly running out of time, but your questions have been great, and we just really appreciate them. And there's many of you that have been calling in. I've got a whole list of questions here. I didn't know people could have so many questions about allergic conditions, but there's a lot involved in this. Another one, has anything new come along for helping itching eyes?
Yes. Itching eyes can be treated with the same medication that we've talked about that was referred to earlier as nasal chrome for nasal allergy and which was referred to as Intal for asthma. This same medication, which its scientific name is Cromolyn, it's marketed as nasal chrome for the nose, it's marketed as Intal for the lung, it's marketed as Optichrome for the eyes. And this is a very effective medication for those patients who have hay fever involving itchy eyes and swollen eyes and who just can't take their fingers out of their eyes during the hay fever season.
We're quickly running out of time, but before we wrap up, I'd like the remaining 3 doctors here to just tell us something about hives. We haven't talked about that a whole lot on this particular, but you made reference earlier, Doctor, to hives and this. Is it allergetic? Is it, again, psychological? Is it physiological?
Most cases of hives are, in fact, physiological, and they're caused by different substances which come on the skin and which you're irritant to. Not only substances on the skin, but things that you ingest, such as, for example, we've talked about reactions to drugs such as penicillin. We categorize or divide hives into acute and chronic, and hives which occur once and last a few days and then may never return again are not really of any significance. But hives which occur over a prolonged period, and for this reason we say over a 3-month prolonged period, over 3 months, we refer to as chronic hives, and these patients really need to be seen by an allergist and to have the cause of those hives determined. In some cases we don't ever find the cause of those hives, but we're able to try and give medication to reduce the intensity of them and to reduce the suffering.
Anything y'all would like to add to that?
Well, there's just one point I think that's important, and that is that sometimes chronic hives or chronic urticaria may be associated with a significant medical illness. And one of the tasks that is our responsibility when we see a patient like that is, if we cannot determine an allergic cause for the hives, to make sure that there's no evidence of a significant medical illness that needs to be treated by another physician. And once that we're assured of that, then we try to manage the hives symptomatically so that the patient feels good at least.
Barry?
Yeah, and just to support what Dr. Crammond is saying, that can be done very effectively with a minimal amount of discomfort.